on.
This is the demonstration for radial abduction of the thumb. That's abduction. The primary mover is the abductor pollicis longus. It's in the first dorsal compartment. Remember the dorsal compartment, we talked about it earlier, but there's two tendons that go through that compartment, and one is the abductor pollicis longus, the other extensor pollicis brevis. So they're palpated very close. I don't know if you can come around this angle and see this, but as she moves her thumb around, this is your extensor pollicis brevis, and this right here is abductor pollicis longus. So, like if you look at try to make the snuff box. Here's the snuff box right here. So, but there's actually a tendon right there, and it's kind of, you can see it kind of popping up and down a little bit. So if you have, when you're palpating for this muscle test, if you palpate either one of those tendons, it's correct. So just make sure you're not on this upper tendon, which is that one. That would be wrong, but this one would be correct, and this one is correct. They're in the same dorsal compartment. Okay, so now, patient is sitting, forearm relaxed, but now you're in a neutral position. The hand is in the neutral position, the fingers are relaxed and forward. You're going to palpate the first dorsal compartment, the abductor pollicis longus, here. You're going to ask the patient to raise up their thumb toward the ceiling and hold it there. Okay? Stabilize the forearm. Palpate the tendon, go ahead and do the motion, and you're going to remove your palpating finger and press downwardly on the first metacarpal here. Just go distal to the CMC joint and press downward here. If they are able to resist strongly, give them the grade of 5. Again, it repeats itself for grade of 2. It's a partial range of motion. So again, you would teach the motion. I know you're weak. Attempt to raise it like you did before, or straight up toward the ceiling. And you palpate and stabilize. I know you're weak. Go ahead and raise up. Partial range of motion is a grade 2.